Hi, Dr. McCarthy here, and I want to welcome you to Neuropathy Success Secret number 3. One of the things that we see invariably with many of our patients who are dealing with neuropathy, the burning, the numbness, the tingling, is that they've never had their thyroid gland tested properly. There are receptors in every single cell in your body for thyroid hormone. So if your thyroid gland isn't functioning properly, those end organs, like your peripheral nerves, can suffer. And one of the things that we'll see is that you'll get burning, numbness, tingling in the hands and the feet. The thyroid could be playing a big role in that, and if you haven't had your thyroid tested properly, you owe it to yourself to get that done. The typical traditional healthcare provider is going to test your TSH, thyroid stimulating hormone. That's not enough. That's not even a thyroid hormone. It's a hormone that comes from the pituitary gland that tells your thyroid what to do. You need to see the whole picture, the whole feedback loop. And it's an intricate feedback loop between your thyroid and the other glands in your body and the cells in your body telling your pituitary what's going on. Some of the things that you need to get tested are your total T3 and your total T4. Your free T3 and the free T4, the free forms of the hormones are the ones that are biologically active. So if your total T3s and T4s look normal, but the frees are too low, you're not going to get a proper thyroid response. T3 uptake, free thyroxine index, reverse T3, these are all critical. Now, here's the big catch. One of the tests that we see very, very rarely run by the traditional healthcare providers are thyroid antibodies. The number one cause of hypothyroid, assumingly decreased thyroid output, the number one cause of that is thyroid antibodies. And we talked about this in a prior video about autoimmune. If you've got antibodies against thyroid enzymes and thyroid hormones, your thyroid gland is not going to function properly. And again, it's not a thyroid problem, it's an immune system problem. So you need to have your immune system evaluated at this point. All of these things can be contributing to your neuropathy pain. So if you're still feeling the burning, the numbness, and the tingling, you're taking the medications that you've been prescribed, and you still feel horrible, it could be because your thyroid gland is involved. If you haven't had your thyroid tested properly, you need to call my office now. Thank you.